Assalamu alaikum. This presentation was some questions and answers on the previous presentation of dysphonia and voice disorders for junior ENT trainees and undergraduates. You may find it useful to go through the previous presentation before attempting to answer the questions in this presentation. Choose the best possible answer. In phonoathenia, the patient's usual voice is normal, but he has a change of the singing voice, change of the voice after prolonged use, has a roughness and harshness of the voice, or he has a change of the professional voice. Choose the most appropriate answer before proceeding to the answers on the next slide. The correct answer for phonoathenia, the patient's usual voice is normal, but he has a change in his voice after prolonged use. The change of the singing voice is false. This is called dysodia. The roughness and harshness of voice is wrong. This is called hoarseness of voice. The change of the professional voice is also called dysodia. And again, it's false. This is a true or false type of a question on the normal voice production. Number one, loudness sensation is related to the subglottal air pressure, true or false. Vocal fold palsy will increase the subglottic pressure. Number three, the voice pitch is determined by the vocal fold lengths, but not the vocal fold tension. And number four, speech production requires energy source, vibration system, and resonating chambers. Choose which is true and which is false before proceeding to the next slide with the answers. The answers on normal voice production question. The loudness sensation is related to the subglottal air pressure. That's true. Vocal fold palsy will increase the subglottic air pressure. That's false. It would decrease the subglottic air pressure because there is constant leak of the air through the glottal opening. Voice pitch is determined by the vocal fold length. That's true, but not vocal fold tension. That's false. The pitch, the fundamental frequency of the oscillation of the vocal folds is determined by the length, the tension, and the vibrating mass. So this is false. Speech production requires energy source, vibration system, and resonance. That's true. The energy source is provided by the air stream from the lungs, building up in the subglottal area. A vibrating system, this is the vocal folds in the larynx, and the resonance in the vocal tract. This is true. A true or false type of a question on vocal folds polyp. Vocal fold polyps are always bilateral. Phonotrauma causes subepithelial capillary leakage, is best treated by Thyroplasty type 1, and recurrence rate for vocal fold polyps is high. Choose the true and false before proceeding to the next slide. Vocal fold polyps are always bilateral. That's false. The vast majority are unilateral vocal fold polyps. Phonotrauma causes subepithelial capillary leakage and hemorrhage in the subepithelial space. That's true. Is best treated by Thyroplasty type 1 is false. It is best treated by Microlaryngosurgery by a microscope through the endolaryngeal route. Recurrence rate is high. That's false. The recurrence rate is very low. A true or false type of a question on vocal folds nodules. Number one, vocal fold nodules usually develop over the cartilaginous part of the vocal folds, are best treated by early surgery, can develop in children, and are pre-malignant lesions. Choose the true and false answers before proceeding to the next slide. The answers for the vocal fold nodules. Number 1, they usually develop over the cartilaginous part of the vocal folds. That's false. They usually develop over the mid part of the membranous vocal folds lesions. This is the part that is most subjected to collision and friction during the oscillation of the vocal folds. This is where the vocal fold nodules can originate. Number 2, are best treated by early surgery. That's false. In the early stages, they are best treated by voice therapy. Surgery is only reserved for the very resistant cases. Number 3, nodules can develop in children. That's true. There are 2 types of vocal fold nodules: a juvenile type in children who screams or shout a lot or abuse or misuse their voice, and an adult type. Number 4, nodules are pre-malignant lesions. That is false. A true or false type of a question on vocal fold cysts. Number 1, they are always bilateral. 2, voice therapy is the best treatment option. Number 3, vocal fold epidermoid cyst occurs due to phonotrauma. Number 4, they are located over the vocal process of the arytenoids. Choose which is true and which is false before proceeding to the next slide. Answers to the questions on the vocal fold cysts, true or false. Number 1, vocal fold cysts are always bilateral. That's false. The vast majority are unilateral vocal fold cysts. Number 2, voice therapy is the best treatment option. That's false. The best treatment option for the cysts is surgery, microlaryngosurgery. Number 3, vocal fold epidermoid cysts occurs due to phonotrauma. That's true. One type of the vocal fold cyst, the epidermoid cyst type, is formed by micro injury to the vocal fold surface and burying of small islands of the epithelial cover under the surface where they would form an epidermoid cyst. So that's true. Number 4, cysts are located over the vocal process of the arytenoids. That's false. They are usually located in the membranous part of the vocal folds. This is an endoscopic image of the larynx with the vocal folds. What is the diagnosis? 1, vocal fold cysts. 2, vocal folds nodules. 3, larynx edema. And 4, vocal fold carcinoma. The correct answer is larynx edema, with massive edema and swelling of both vocal folds. They are still covered by intact epithelium. It's not vocal fold cysts, where they are usually unilateral and usually localized rather than diffuse swelling of the vocal folds. It's not nodules, when there are just a thickening in the mid part of the membranous vocal fold, always bilateral and always opposite each other. It's not vocal fold carcinoma because the surface epithelium here is not ulcerated and it's not irregular. It's just diffuse, massive swelling of both vocal folds, characteristic of larynx edema. Choose the most appropriate answer. Contact granulomas. The treatment options for contact granulomas include the following, except: Number 1, proton pump inhibitors, voice therapy, antibiotics, or laryngeal muscles botulinum injection. Choose the most appropriate answer before proceeding to the next slide. The treatment options of contact granuloma includes proton pump inhibitors, since laryngopharyngeal reflux is one of the causes for the contact granuloma. It also requires voice therapy to decrease the amount of tension on the vocal processes of the arytenoids that causes the contact granuloma. They are not treated by antibiotics. They are not caused by infection. So this is the most appropriate answer for the treatment options except. And number 4, laryngeal muscles botulinum injection is correct because sometimes in very resistant cases, to decrease the tension on the vibrating vocal folds, you would need to inject botulinum toxin to decrease the amount of injury and microtrauma that causes the contact granulomas. This is an endoscopic picture of the larynx at the level of the vocal folds. What's the diagnosis? Congenital laryngeal web, laryngomalacia, acquired laryngeal web, or chronic laryngitis. Choose the most appropriate answer before proceeding to the next slide. The correct answer is congenital laryngeal web. This is the classic picture of a large web between the two vocal folds covered by intact epithelium with a smooth edge and no irregularities. This is features of the congenital laryngeal web. It's not laryngomalacia, that's false, where the lesion, the defect is supraglottal structures collapse during inspiration. It's not an acquired laryngeal web, where it's more irregular. Acquired type is more irregular and smaller bands either in the mid part of the glottis or towards the anterior commissure. And it's not chronic laryngitis because you can see that the epithelial cover here looks normal. Endoscopic picture of the larynx, the vocal folds, and the supraglottal part of the larynx. What's the etiology of these papillomas? Voice misuse, human papillomavirus, long-term smoking, or laryngopharyngeal reflux. The correct answer is human papillomavirus that causes the laryngeal papillomatosis. It's not caused by voice misuse. This is false. It's not caused by long-term smoking. This is false. And it's not caused by laryngopharyngeal reflux. A true or false type of a question on vocal folds dysplasia. Number 1, there are whitish patches over the vocal folds. 2, reddish patches over the vocal folds. 3, extend only in the superficial third of the vocal fold covering epithelium. Number 4, smoking is a precipitating factor. Choose which is true and which is false. Answers to the true or false statements on vocal fold dysplasia. Number 1, the vocal fold dysplasia features may include whitish patches over the vocal folds. That's true. They are then termed leukoplakia, or they may be covered by reddish patches over the vocal folds. That's also true. It is then termed erythroplakia. Number 3, the dysplasia extend only in the superficial third of the vocal fold covering epithelium. That's false. It extends to the superficial third of the covering epithelium in mild dysplasia, to the superficial 2/3 in moderate dysplasia, and full thickness of the epithelial covering in severe dysplasia. So this is false. Number 4, smoking is a precipitating factor. That's true. Smoking is the major precipitating factor for laryngeal dysplasia. Right vocal fold palsy, the etiology can be caused by the following, except choose one, the most appropriate answer. Number 1, skull-base tumors. Number 2, thyroid carcinoma. Number 3, thyroid surgery. Number 4, bronchial carcinoma. Choose the most appropriate exception. before proceeding to the next slide. Right vocal fold palsy due to recurrent laryngeal nerve paralysis on the right side can be caused by a skull-based tumor. That's true. It can be caused by thyroid carcinoma. That's also true. Thyroid surgery. That's also true. But the correct answer, the correct exception, is bronchial carcinoma, because bronchial carcinomas can cause only left vocal fold palsy. The right recurrent laryngeal nerve does not dip into the thoracic cavity to be affected by bronchial carcinomas. Multiple choice question on unilateral vocal folds abductor paralysis. Unilateral vocal folds abductor paralysis may present with the following, except look for the one exception. 1. Aspiration. 2. Weak and breathy voice. 3. Laryngeal airway obstruction. 4. Weak cough. Choose the only exception for the presentation of unilateral vocal fold abductor paralysis. In unilateral abductor paralysis, there will be difficulty of the paralyzed vocal fold in reaching the midline to meet with the other vocal fold and close up the glottal chink, so they can aspirate. This is true. They can have weak and a breathy voice. This is also true because there will always be a persistent gap between the vocal folds during swallowing and during speech or voice production. Laryngeal airway obstruction, that's false, because they will always have a patent laryngeal airway. Weak cough, that's true, because with a gap between the two vocal folds, there may be not enough subglottic pressure built up to give effective cough. So all these presentations are true except laryngeal airway obstruction. This is the correct answer. True or false statements on unilateral vocal fold abductor paralysis. Number 1, the voice is almost normal. Number 2, there are problems and difficulty in swallowing and cough. Number 3, the commonest cause is bronchial carcinoma. Number 4, management is directed towards finding the cause of the paralysis. Choose which is true and which is false. In unilateral vocal fold abductor paralysis, the paralyzed vocal fold will be lying close to the midline, so there should be no problems with voice because the paralyzed cord is very close to the midline and the glottis can close up during phonation, during swallowing, and during coughing. There should be no problems with that. The problem in the unilateral vocal fold abductor paralysis is what caused it. Probably bronchogenic bronchial carcinoma, and a CT scan of the chest is important. The voice is almost normal. Number 1, that's true. Number 2, problems with difficulty in swallowing and cough, that's false. There should be no problems with aspiration or any problems with coughing. Number 3, the commonest cause is bronchial carcinoma, that's true. Number 4, the management is directed towards finding the cause, that's true, because the patient may not have any problems with voice, swallowing, or cough. He does not require treatment for the paralyzed vocal fold, but the cause of the paralysis should be identified. In bilateral vocal folds abductor paralysis, the treatment options of bilateral vocal folds abductor paralysis include the following, except what is the exception. Number 1, tracheostomy. Number 2, laryngoscopic laser to widen the closed glottis. Number 3, Thyroplasty to reposition vocal folds in abducted position. Number 4, voice therapy. The answer to the question, The treatment options of bilateral vocal folds abductor paralysis include the following, except what is the exception? The exception is voice therapy. In bilateral abductor paralysis, the vocal folds, the two vocal folds, are lying close to the midline, so there is almost a closed vocal folds chink and closed glottis. The treatment is to open up the airway because the patient was present with airway obstruction. So tracheostomy can be one of the correct treatment options. Laser to widen the glottis, remove parts of the vocal fold and cut through the muscles of the vocal folds and remove some parts of the arytenoid cartilage is also true to open up the airway. Thyroplasty to reposition the paralyzed vocal folds in an abducted position to open up the airway can also be one of the treatment options. Voice therapy is not a treatment option because the patient's presenting problem is airway obstruction. So this is the correct choice. MCQ question on habitual dysphonia. Functional habitual dysphonia include the following, except what is the exception? Number 1, hypofunction dysphonia with breathy voice. Number 2, hyperfunctional dysphonia with pressed voice. Number 3, spasmodic dysphonia. Number 4, ventricular dysphonia when the ventricular folds contribute to the voice. The answer to the multiple choice question, what is the exception for the following? Which of them is not a part of the functional habitual dysphonia? Number 1, hypofunctional dysphonia with breathy voice is one of the habitual dysphonias group, so this is true. Hyperfunction with pressed voice is also one of the group of habitual dysphonia. Spasmodic dysphonia is not one of the types of habitual dysphonia. So this is the correct answer. This is the exception. Ventricular dysphonia, when the ventricular bands can meet and oscillate and contribute to the voice, is also a part of the habitual dysphonia groups. So this is also true. True or false statements on psychological aphonia. Number 1, the onset is usually acute. Number 2, the young age group is affected more. Number 3, no difficulty in cough or swallowing. Number 4, the vocal folds meet in the midline during phonation but don't move during cough. Which is true and which is false? In psychological aphonia, the onset is usually acute. This is true. The young age group, that's also true. There's no difficulty in cough or swallowing. This is true. The vocal folds should be actually mobile and have no difficulty in coughing and no difficulty in swallowing. So that is true. Number 4, the vocal folds meet in the midline during phonation. This is false. The patient will always keep the vocal folds apart during phonation so that no voice can be produced. But don't move during cough. This is also false. They would move normally during cough and meet in the midline. So number 4 is false. MCQ question on laryngeal carcinoma investigations. The investigations for patients with laryngeal carcinoma would include the following, except what is the exception? Number 1, a CT scan for the neck and the chest. Number 2, an MRI scan for the neck. Number 3, voice laboratory for recording and analyzing the voice. Number 4, laryngeal endoscopy and biopsy. What is the exception of these investigations? All these investigations are required in laryngeal carcinoma except voice laboratory and recording and analyzing of the voice. This is not a part of the routine workup for laryngeal carcinoma. The workup would include a CT scan of the neck and the chest to see the extent of the tumor in the neck and its spread in the lymph nodes, and also whether it has extended to the chest or not. Occasionally an MRI scan would be required to add some more features, like some features of the depth of invasion in the larynx. Voice laboratory is not required routinely, and there is no much value in analyzing the voice for diagnostic purposes. Number 4, laryngeal endoscopy and biopsy is always required. So number 3 is the correct exception. Multiple choice question on unilateral vocal folds palsy treatment. The treatment options include the following, except what is the exception: voice therapy, thyroplasty, vocal folds injection medialization. Number 4, total laryngectomy. What is the exception in the following treatment options for unilateral vocal fold palsy? Number 1, voice therapy is one of the treatment options. This is true. Thyroplasty is again one of the treatment options for unilateral vocal fold palsy. So this is true. Number 3, vocal folds injection medialization is one of the treatment options. So this is again true. Total laryngectomy is not one of the treatment options for unilateral vocal fold palsy. So this is the correct exception, the correct answer. By this, we come to the end on this presentation on questions and answers on dysplasia, voice disorders for the undergraduates and ENT trainees. Assalamu alaikum.